Hi, in this video we'd like to talk about a very common misdiagnosis for uterine shape and size. So a HSG is how we test for uterine volume, uterine shape. A lot of doctors and hospitals will actually misdiagnose, not wrongly or intentionally. They also believe that uterus with certain shapes and size that we believe are abnormal, they believe is actually unproblematic, perfectly normal, and is suitable for a pregnancy. Usually if this patient goes for pregnancy, you will realize that they quickly will have some form of pregnancy loss, whether it be a chemical pregnancy, whether it be a early miscarriage, fetal demise, can happen in many forms. But usually, if it's unexplainable, where it usually is the case, it can be linked back to the initial abnormal uterine shape. Now, the two most common misdiagnosed uterine shape and size is a naive uterus and a septate uterus. Now, these two uterine shapes and size here at Antai Hospital, regardless of severity, you can be as mild as you want, all the way into the severe end. We will take it as equally severe because both ends of the spectrum can lead to pregnancy loss. So if you know anybody who's having unexplainable miscarriage consecutively for years, if they are unable to get pregnant, even IVF cannot help them, usually it's caused by a mixed diagnosis. The doctors do not know that a mild septate or even a mild naive uterus can cause a pregnancy loss repeatedly if not treated. These uterine shapes and size actually look very normal. Now you can take a look at these two images here. They look normal to the naked eye, to any professional, but they can actually cause high-risk pregnancies, miscarriages. Now, a healthy uterine shape and size, here at Antai Hospital, we've studied for over 25 years. We can tell you for certain that a healthy shape and size of a uterus does not look like these two images. It has to have a pear-shaped size, pear-shaped volume, an upside-down pear shape. So a dome on the top. There cannot be any indentation downwards. It should be a dome on the top, and then slowly it indents and connects via the cervix. It has to look like this. Otherwise, there could be a high risk of a pregnancy loss, miscarriage along the line. So many doctors don't catch this, and then they recommend you go for IVF because you've repeatedly miscarried and no doctor can explain, despite them being experts in fertility and miscarriage prevention, but they still cannot identify what is going on. And here at Antai Hospital, when these patients come to us with their history of over 10 miscarriage, consecutive miscarriage, talking to all forms of experts, when we look at their reports, we immediately know that there's a misdiagnosis of a HSG, their uterine shape and size. Usually it's a naive uterus, or septate, or a combination of the two. And this is the most common form that we encounter on a daily basis. So your doctor may say otherwise, but your pregnancy outcome is the determinant factor here. Whether or not you have a successful pregnancy, whether or not you get pregnant, or if you miscarry, that's what we look at. And here at Antai Hospital, we've already helped over 35,000 couples achieve their pregnancy by taking a septate seriously, by taking a naive uterus seriously, because we know what we are doing, and we've been doing one thing very effectively, which is preventing miscarriages and sustaining full-term pregnancies. So for septate and naive uterus, if diagnosed properly, we only need to do a very straightforward laparoscopic or hysteroscopic treatment just to restore the shape and size. We need a pear-shaped uterus, so there's usually an excess connective tissues within these uterus. So when implantation happens on these connective tissues, there's very poor blood flow, oxygen, causing the miscarriage. It can also cause the embryo to flow into the other fallopian tube if it's much more severe. This one will cause tubal pregnancy, and then they will remove your tubules, fallopian tubes, and your fertility drops 50%. And then if it happens again because no doctor is treating you, you lose both fallopian tubes. Now you can only have IVF, but still the septate is still there and you still experience repeated failure and waste a lot of resources. When the problem is so direct and staring at us right in the eye, for us at least, because we've been identifying septates in naive uterus of varying severity, and all of them can lead to pregnancy losses if not treated. So here at Antai Hospital, we offer you a full refund guarantee. If you know anybody who's experiencing repeated failures in IVFs, pregnancies, usually there's a problem with a naive uterus or septate uterus, and we offer you full refund guarantee. If you still miscarry, then we offer you a contractual money-back guarantee of treatment costs because our success rates are up to 95%. So schedule an online consultation with us via the website, and also read our articles, our YouTube videos, leave us a comment, leave us some feedback, and stay tuned to the next one.